This is really a great day because we reached our 4th annual International Sports Pharmacy Symposium. We will continue with Mikko Lemettilä from Finland. He's a specialist, clean exercise commitment, and he is the founder of A-Clinic Foundation, master's student in pharmaceutical research, development and safety in University of Helsinki, also outdoor cross-training team, Rotoma, and he will share his own journey and experiences with us with the title of Sports Pharmacy Awareness of Recreational Performance and Enhancement Supplements Use.
Talk a little bit about recreational performance enhancing substance use. And you could even add the word image into this context. Usually when we move outside of the context of organism, image-related motives or appearance-related motives also start to emerge, because why people start to dope. A little about me. Mikko Lemettilä introduced me. I'm a specialist working in the A-Clinic Foundation, and I focus on anti-doping activities in recreational sport. You can find my contacts there. So in LinkedIn, I try to, discuss the addictions in sports and exercise, sports pharmacy, anti-doping, recreational doping, and electronic performance drugs. So ISPS or PIEDs, like call them here. And in those free social media accounts, Instagram, I'm usually just promoting exercise, of course.
Sorry, Mikko, is it possible to increase the volume a little bit up? Is it possible?
I don't know, because it's coming straight to my head.
Is it good for everyone? Is it good for? Let me check. Sorry for disturbing you, for cutting your presentation. Okay. Is it okay for everyone? Can you hear the voice? Is there any problem?
Yes, we can hear.
All right.
Okay. Good.
Okay. Please keep going. Thank you.
All right. Sorry. I'll start again. Wait a sec. Right, I'm back with the presentation. Yes, good. And yeah, so a little bit about the context where I work in. So I work in A-Clinic Foundation, which is usually known in Finland about alcohol-related harm reduction or prevention, but also other drugs as well. And A-Clinic Foundation has been working with public health doping prevention initiatives as well since 2010. Our focus groups are current performance enhancing substance users and those who might consider using, but also the adjacent ones. There's one thin word in the middle. Missed that, but it means like relatives and friends who are of a PES user, for example. And also we provide information for professionals as well. So we have anonymous health counseling for those who use performance enhancing substances. We maintain an info bank, evidence-based info bank, web-based service. We have clean exercise commitment for fitness professionals. So it's an anti-doping communication tool for people working, for example, gyms or municipal sports venues. And then we educate different professionals, for example, healthcare, fitness, and security professionals about doping. And also we participate in the international projects. So I will talk about one international project later in this presentation. Few words about recreational PES use. So the international estimate for the use of anabolic steroids, which is the most common performance enhancing substance, is known to be about 3.3% globally. And we know that 6.4 among men are using and 1.6 among women are using. So a lot more use in men, especially young men. The most, like I said, the most commonly used are testosterone and anabolic steroids. And what is important, because they're outside of organized sports, this is usually when different countries' legislation comes into play, and what is classified as doping agents, it also has varying aspects. So in terms of health counseling, criminalization of recreational doping varies between countries. So for example, in Finland, doping use isn't criminalized outside of sports or even inside of sports, but no penalties from the legislative side. And also the prevalence of use varies among specific groups. So to give some Finnish context, for example, in our health advisory service, our typical person who is asking about substance use is usually a working man aged 25 to 34 with a vocational education background. And this is quite similar to other substance use as well, like what are like risk factors. Men are mostly using substances and with a lower educational level. And then the prevalence is a lot higher in the, for example, in the prison or criminal world. So there's a recent study in Finland conducted that investigated. It was a use of performance-enhancing substances among prisoners, and in that population, 44 have had used doping substances at least once in their lifetime. And of all prisoners, so females included, women included, 34% have used doping substances at least once in their lifetime. And the injunction of their style of using. And what is alarming is that the youngest in this population was also started at the age of 15. So we really need to target youth prevention strategies. And here to give context, so organized sports usually has its own penalty system and it's following the prohibited release, like we all know. But when we're outside of sports, we're not following the what are called legislation to play more. And then the substances classified as doping agents vary between countries. And there's an example from the Finnish criminal code. So we classify substances as doping substances. We classify are synthetic anabolic steroid and derivatives, testosterone and derivatives, growth hormones, and chemical substances that increase the production of testosterone. For example, we have selecting estrogen receptor modulators. Here, we know that sports usually has performance-related motive for use, winning-related glory. But when we focus outside of sports, the motives become more diverse, and usually the appearance-related motives are more emphasized. So why people are using outside of sports would be aesthetic reasons, for example, for modifying body image, then increasing sexual desire and attractiveness, improving performance, capacity. This involves cognitive enhancement as well. And then bodybuilding, non-competitive bodybuilding, maintaining youthfulness, anti-aging, faster recovery. And then at some point, these substances might also become addictive, so they might really self-treat with other doping substances, about their addiction, or then self-treat just another mental health issue that's the main reason for using. And as I mentioned, the prisoners in criminal world, maybe there the motive is more like increased perceived domination or authority or status. You want to increase your status in a certain subculture. Here's one example of how it's classified doping substances outside of sports. For example, categorized them by motive of use. And they, of course, they overlap as well. Here are some substances commonly used in recreational sports. And the motive is, for example, post-cycle therapy. So first you have the cycle, you try to increase strength and muscle mass, and then you continue with post-cycle therapy. and where the goal is reducing side effects. Then other motives, for example, be weight loss, fat burning, then increase in endurance or cognitive, and for example, increase your cognitive skills in working life or studying life. And esports is also well known about cognitive enhancers. Some methods we should be aware of for these commonly used substances, testosterone and anabolic steroid doping. People tend to stack one or two or more different substances simultaneously. It might involve a pyramiding technique where they first start with low doses, increase it to the maximum peak level halfway, then reduce cycle the second half. The idea is they want to maximize the effects, and they think this would also minimize harm, but it is not that simple. And these are two different ways of using. So you could use them in cycles, or then use them constantly, so without cessation of use. And the last one I described is called blasting boost. They use in this training phase, you blast with higher doses, and when you're usually when you're off cycle, you would tend to boost in this period with smaller doses. And here's an example of bodybuilders, but this is same logic applies for for training in the gyms, not just bodybuilders, but other people. So usually for the cycle, you could combine testosterone and anabolic steroids, and then use other substances to enhance the effect as well, such as insulin or clenbuterol, which has a different mechanism of action. And after this cycle, they would proceed to post-cycle therapy, where they would try to, launch their natural testosterone production. Because this outside testosterone suppresses your own testosterone production. So post-cycle, they try to again launch it. Work. And they are using it. Supraphysiologic doses usually, which means and above medical use doses. So here's an example, one from Finland. Example, we have the Sustanon medication, which is usually used for testosterone replacement therapy in adult men. And there, the typical use would be 1 milliliter every 3 weeks expiration. And total of 176 milligrams of testosterone. And you can see in the table an example about male bodybuilders doses. So it would be 250 to 750 milligrams per week. So they exceed the medical dosage already first week. And as we sports pharmacists know, the adverse effects vary depending on substances used, and health risks are more likely when substances are used over a long period of time. You use multiple substances, like the bodybuilder example I showed you, and when we exceed the medical recommendation of risk, or likely then. Other factors contributing to health risk are impurities of contaminated substances. These substances might be, for example, being acquired from black market, so we're not really aware what the substances really include. And there's also risk associated with improper injection. So if they're using intramuscular, there might be risk of other infections such as HIV or hepatitis. There's dependency or addiction, which brings its own mental health risks. And then also the use of, for example, testosterone and anabolic steroids have psychological risks in their adversaries as well. And usually those who are using also are using recreationally, they use other drugs recreationally as well. So they might combine alcohol, cannabis, opioids, illicit stimulants, which is more recreational substance use in general. And these are real questions that have come to our health counseling service, just to give you an idea about how diverse the people out be. For example, there's a 40-year-old man who's trying to start self-administered replacement therapy. So maybe he would try to first add testosterone from healthcare, but couldn't receive it, and then he would start using by himself. There's also under 18-year-old boy who claims that he has been working actively in the gym, and now he hasn't got that much progress, and now he decides to start using steroids to get the results faster. Then there are some questions about the adverse effects. So before they use, they are still interested in the adverse effects. So this might be a case where we are able to prevent use as well. So they are aware of the potential. Usually what they ask could be related, for example, to sexual desires or sexuality. And then there's also women who are sometimes reaching out to us. There's this one sad case where the woman had been persuaded to start using by her adjacents, and then during the use, she noticed hair loss and deepening of voice, and was wondering if the hair would ever grow back, or the change, or are the changes permanent, like the voice return, it go back to normal. For pharmacists, I want to give tools about identifying a user in healthcare, like substance abuse in general. This is usually secretive, so even the family relatives don't know that the user is using, and they all usually share information in their own peer network. So only the peers might be aware of the use. What could be an example about how to encounter would be in pharmacy would be an injection-related inquiries. So they might, for example, ask about muscle needles that are meant to be used for anabolic steroid injections. Some symptoms you might see them during the pharmacy reception or during the health counseling. So you should be aware of the physical and psychological side effects, for example, anabolic steroids. And some mood disorders as well might emerge. They might be aggressive, hyperactive. They might have exaggerated self-confidence, unusual interest in physical training and body image. They might expect depression, especially when they're not using, and also other risky behavior, like I mentioned, for example, other substance use. And here are the well-known adverse effects associated with steroid use. And I recommend you to go to the site Human Enhancement Drugs. It has a lot of these infographics and other evidence-based information related to human enhancement drugs use. But for example, well-known adverse effects of steroids are heart-related diseases, body, facial hair growth, vocal change, major mood disorders, and dependence of steroid use. And and also the suppression of testosterone production, and what happens is the sexual dysfunction as well during that. How could you intervene? Pharmacists have a lot of different situations where mini intervention, for example, 10 to 15 minutes health counseling would be possible. So I would encourage everyone to at least try if the user would be willing to take help or support. And there are even these useful first questions mentioned in human enhancement drugs network as well. So, for example, do you use or take anything to help with your workout or muscle gain? And tell me about the supplements you are using, including any use of pills, powders, or injectables. So it doesn't need to be a straight question. It can be something related that might make the patient admit using. And if there's a counter response, you could just be that. Why are you asking? I'm asking because I'm a healthcare professional. And I'm interested to see if we need to be checking for any other related health issues. If the user admits using, you could ask about the age of initiation, current use, including duration, sample amounts, method of administration, and what are the underlying issues or motives for use. So the underlying issue is the one that needs to be treated. So if, for example, anxiety, depression, or lack of body confidence. What adverse effects is the patient feeling? Are there psychiatric symptoms, sleeping disturbances, or signs of dependence? And also social history. For example, she started using because of peer influence, and are there any current medications? So all of this just to know how serious the use is. And here are the red flags I also mentioned in this guide for steroid harm reduction. Should be, so if you would see these kind of red flags, you should direct some healthcare and further treatment. One red flag is that the user is younger than 21, so a young person. There are high risk of irreversible complications when we're using it at younger age. If there's hypoandrogenism, features of dependence, mood disruptions, comorbidities, concurrent alcohol or other drug use, and risky injection practices or risky sexual use. And I also listed some support material for sports pharmacy professionals to you guys. So, like I said, in those acute cases, please refer the user to follow-up treatment or even acute care. And this is because if they would be willing to cessate, it should always be supported by multidisciplinary efforts. So usually the endocrinologist is involved, psychotherapy is involved, and peer support would be helpful as well. And here are the support tools I listed. There's this guide to harm minimization for patients using non-prescribed AAS. You should look into our doping info bank. We have materials in English as well. There are some assessment tools where you see how serious the use is. For example, if there's any exercise addiction involved, you could use exercise addiction inventory. And also there's a tool for assessing the anabolic steroid dependence wrote by Carter and Baldwin with recent publication. And in some cases, the user isn't willing to stop. So we as healthcare professionals should always consider if harm reduction would be the correct way to help the patient. So at some serious cases, maybe we can even life-safe injecting, just reduce those injecting-related risks. But it is always individual, which is the best approach for each person. Some few words about what's next for me, and if you're interested in our project, please you can contact me later after the symposium, for example. I can tell more about the projects. But we're currently focusing on this project IRIS, which is an Erasmus sport project, and it focuses on nutritional supplements, doping risks, and really improving athletes' risk based decision making towards nutritional supplements used in recreational competitive sport. Then we have an upcoming scientific publication in 2 days where publishing in Finnish, but the abstract is in English, and I will share it in my LinkedIn as well. So the topic is encountering of recreational doping users in pharmacies. It was a survey of Finnish pharmacists that which kind of situations would the pharmacist encounter doping substance users. And I can say that much, so usually it's related to injecting practices and intramuscular needles. And also in January, we have a Human Drugs Network webinar coming up. So if you're interested in the Nordic countries model of doping prevention in recreational, or please register to this event. We will hear all about our prevention measures in Sweden, Denmark, Norway, and Finland. And some final words. I encourage everyone to promote clean sports and exercise in all of your practices. And we should always remember that the sustainable motives of sports and exercise. So there's this one quote from the Code of Sports Ethics Council of Europe and about fair play. I think it applies for clean sports and exercise as well. So we should remember that exercise should be positive. It should be social, cultural, friend. It involve friendship. It can be a place where you increase your self-knowledge, self-expression, and fulfillment. You get personal achievement, new skills, all that enjoyment, good health, well-being. And also it somehow involves sensitivity to our surroundings as well. So let's try to, support each other, be sensitive to our social and social environments. Yeah, that was my short presentation on awareness of PES use in recreational sports. So here are my contacts again. Thank you for your time. If you have any questions, I can now answer them.
Okay, Mikko, thank you for your presentation and especially underlining the red flags. And also, I am remembering that you shared a post about kind of accreditation of the sports centers for supporting the clean sport. I think this is a kind of new movement in your country. Can you please tell us about this? Do you remember this one?
Yeah, yes. You mean the clean exercise commitment targeted at fitness centers?
Clean exercise
Yes.
commitment.
Actually, it's quite old, but during the time it moved to the Doping Link Service or Egg Foundation. But I don't think it might be 20 years old model. But first it was
But almost it was inspiring for I think for the other countries because when I saw this post I started to think about how can we improve this idea to create accredited sports centers in locally.
Yeah, so I can tell you a bit about the model. So usually it's an anti-doping agreement aimed at fitness centers. So through our model, they sign this commitment, and what the commitment actually means that they will promote health and well-being in all of their actions. And if they would encounter a doping use, they would somehow be obliged to involve that use. Our perspective is always that we try to offer help and support first. So we don't want to fire the user. If you're using gym facilities, we don't, support that they would fire the user, but more like offer help and support first. But of course, some gyms and fitness centers are more strict and they would not tolerate any kind of use. And we have some common ground in that as well, that we try to say to the fitness center entrepreneurs that don't allow use in their own facilities. So if you're use somewhere else.
So this was really
yeah.
Sorry, please keep going. Sorry.
Yeah, and there's what else? Yeah, usually the advice we give that they would advise the user to contact our low threshold health counseling service, and if they don't have any other tools to encounter the user. And then there's one rule about organized sports as well, so they would be obliged to cooperate if there would be a doping control situation. So then the fitness center would cooperate with the doping testers, but that's only for organized sports.
Okay, so as you mentioned and underlined that okay, we can maybe take under control to the transfer of the or we can also control the use of supplements in pharmacies, but the gyms and the sports centers are other important treats for reaching easily this kind of uncontrolled and maybe contaminated supplements. This is the important point.
Yes, this varies between countries. I don't know, but usually the nutritional supplement products in Finland, for example, in pharmacy, are safe to use. But I don't know if the gyms or fitness center, what are they selling as nutritional supplements and where they're getting from. But if for example, you would order high risk supplements from the web and then sell in your facilities, there might be a inadvertent risk for doping substances.
Okay, I think there is one question or contribution. Let me read. Hello, I'm Dr. Joy Mangic from Kenya. I am exploring options for studying sports pharmacy and will love your suggestions. Your advices will be really helpful as I navigate this decision. Thank you.
Yeah, I would be happy to keep my ideas. If
Okay.
Joy wants to send me a message
yes,
by email, whatever.
Of course, you are always ready to share your experiences and your knowledge.
Yeah,
Thank you for this collaboration. Thank you for this collaboration. Okay, Mikko. Thank you again for your important presentation and for always you are supporting this network. You are always caring about improvement of and enlargement of this network. We will see again. We will. Okay, let's stay.
Yeah, we'll see you again. Thank you, Sovereign. Thank you for all the organizing. Let's hear from each other soon.